Hello, we are with Kimika from NHS. Before we get into lung health, can you tell us a bit about yourself and what your role involves?
Just to say thank you for having me along. It's a privilege and a great opportunity just to speak to people about the lung cancer screening. My name is Kimika. I'm the lead nurse for the lung cancer screening program. But before I got into lung cancer screening, I've originally qualified and worked on a ward as a oncology, so a cancer nurse on the ward, seeing patients day in, day out, helping them with their daily activities.
People might have heard about lung cancer screening but not really know what is involved. What actually happens when someone is invited for a lung check?
Yeah, so within the lung health check, the aim of the program is to try and identify patients at those earliest stages before, hopefully before they're symptomatic or they present with symptoms. So the idea is, can we pick up lung cancer earlier with this screening program than we would have done had they not had the program? So the idea is if a patient needs to come and see us, we send out what we call an invitation. So that's an appointment letter. In that appointment letter, it has the date and time that we or the admin team would be calling the person. And in that invitation comes a little booklet that explains a little bit more about the process. And in that, they'll ask them some questions over the telephone about their general lung health check. Or their lung health in general. And then if they progress, then we invite them for a face-to-face appointment. And in that face-to-face appointment, they might meet myself or one of my colleagues, and we will go through some similar questions, and then they should be able to have that CT scan.
A lot of people think they'd notice lung cancer if they had it. Is that true?
That's sadly not true. We have had quite a lot of what we consider healthy people that have actually come through our doors, and they're like, I feel fine. They're telling you that whether or not they're exercising regularly, keeping down their job, been working for many years with no issues. And when we give them the diagnosis, they're pretty shocked because they're telling you that they were out walking, looking after their grandkids, going to the gym, etc. So definitely that is, it's not the case. You don't always know. For some patients, they might know at the early stages, depending on where it is in the lungs, because there's some areas, if there is an abnormality there immediately or very early, not immediately, but very early, they might be symptomatic. But some people, they actually don't know until they possibly present to A&E.
Some people feel they don't need screening because they have stopped smoking, feel well, or recently had another scan. What would you say to them?
For those that have had other scans, I'll say the best thing they could do is actually contact us still. So if you've received the invitation letter and you're like, I had a scan the other day, it doesn't matter, then don't think like that. Because the scan that you're having in that occasion might be for something completely different. It could be for another part of the body, or it might not be the right format that we're looking for. So ours is called a low-dose CT scan, and it's actually gone through rigorous testing and shown to be able to pick up those smaller nodules really well. But somebody might say, but I had a chest x-ray the other day. No, we don't want the chest x-ray. We actually want a CT scan because we know that can pick up those smaller spots on the lungs that we could monitor. I've stopped smoking. It doesn't matter. It always matters because, unfortunately, having smoked, we're looking at people with an increased risk compared to the general population. So even though so fantastic, well done for stopping, but we know that the fact that they smoke puts them at an increased risk than the general population. So don't be scared.
For anyone wondering what the scan involves, can you talk us through what people can expect?
So when a patient has the scan, obviously they would have gone through what we call the telephone screening, where we ask all those questions about the lung health. And then when they come to see us face to face, we ask them similar questions, just checking that the information that they've given is accurate. Because a lot of the time when we receive the information, we call those patients, and some of them might say, I've never smoked. So it's really important that the patients or the people that are coming to see us make sure their information is correct with their GP. Okay, make sure that their smoking status is on their GP records is accurate, and that they don't be worried about saying that you smoked. It's important for us that we do capture those people so that they can come in and have the CT scan on the day. They normally have the lung health check, okay, and this can vary up and down England, but for us within the North Central London, they have the scan on the same day as they have the lung health check, ideally. So the radiographer will invite the patient for the scan. They will ask them, do you have, for us ladies, do you have on a metal bra? Because actually, if you think about the position the patient will be in or the person will be in, that metal will show up on the image. So we ideally ask them to remove the bra. And sometimes people have on chains, and all they'll ask, some people say to me, I don't want to get rid of my chain. So what we say is, if you could just pop it behind your neck on the scan, and then they'll be asked to lie flat on the machine, breathe in, hold, breathe normally. On some machines, they'll be asked to only do that once, but on some of our other machines, then they might ask them to do that 3 times, just to make sure that we get the full image of the lungs, and then that appointment is concluded.
If someone listening is eligible for feeling unsure or nervous, what would you say to them directly?
And I just think that the team that we have is just so supportive. They actually listen to the patients. Sometimes patients or people already tell us that they're anxious about the scanning machine. They want to know what exactly is going to happen. And whether or not it's the admin team or the nursing team, they can reassure them in that regard. And then I just say, remember that people come for scans for various different things, and if you come for it, hopefully that should give you peace of mind once you get the results, that somebody technology is created in such a way that we can see what's happening, and just to be reassured. And then if there's nothing, a majority of the people, nothing's found. If something's found, we follow up accordingly. So, for example, if we see something, we actually have a nice little leaflet that explains what we call the next steps. So the person has the scans, and if it's a normal result, they might just receive a letter saying it's all clear, come back in 2 years. But if there's something found, there are numerous ways that we can further investigate what it is that we found. And then if, again, that's all clear, then they'll be invited in a couple of years' time. But if something's found, the aim is that that is found at a much earlier stage so that we can provide the treatment that's needed for the individual. So definitely don't let anything put you off. If you're unsure, ask questions. And obviously I know that language might be an issue for some of our people. And one of the things that we have is something called Language Line. So we've actually got to dedicate, the admin teams developed this dedicated day of the week that we actually use a translator to actually go through the questions with individuals. So when we initially call, sometimes we don't know if there is a language barrier, and at the point that we call, they're like, no English or can't understand. We then book them onto a list, and then we're able to actually call them using a translator. So it's actually a 3-way call, and then we go through the questions with the individual using the translator, and then we're able to ascertain those answers. When they come to the face-to-face appointment, in the appointment, we're then able to have a telephone interpreter in their language and then go through that to make sure just that the answers are accurate, the person feels comfortable, and that they get the best experience out of the appointment. When they go to the CT scan again, we've got that language, it's got the automated language. So we've got quite a few, London, very diverse. So we've got multiple languages on the machine, and they just need to press the button and it gives them the instructions in their language, which we found really, really helpful for our patients.
What are the key messages you would like people to take away?
One of the main ones I want to say is don't be scared. Always think about your symptoms, because we have a lot of people, similar to what you said in one of the earlier questions. Speak if you have any signs or symptoms. Speak with your GP, and some of the signs or symptoms include new increased shortness of breath, a persistent cough that doesn't seem to be going away, and in some cases, for some patients, it's coughing up blood. So those are all, even though we've got the lung cancer screening program, there's a lot of other things that's going on in the background that people can be proactive about on their symptoms. And in my experience, I've had, if it's not the patient themselves, they come back in and said, oh, my friend came and they found something, so that's pushed me to come and get checked. Or they say, oh, why not? Why not? It's been offered to me. Why not have, I can't see what's inside, so why not get a machine or somebody else to tell me what's happening? So just don't be scared. Just use the opportunity. If in doubt, I'm going to give some contact details there. Just reach out to us and we can explain anything that's necessary. And one of the things I'd also like to highlight is that there's some cultural differences. So whether or not it's race, gender, that type of stuff, just be mindful that if there are those issues, we can work around them. We can make reasonable adjustments to support people. We've had patients or people with learning disabilities. And so that one, we actually have the opportunity to take a bit more time with those people. We actually sometimes have to do demonstrations. Sometimes we have to make the appointments a little bit longer just to accommodate those patients. And it's something we're happy to do because we know it's necessary.
Great. Thank you very much for this interview. I know you will touch to lots of people.